In today's video, we are going to review the respiratory assessment, and it is coming from my RN Notes, F.A. Davis, 5th edition. So basically, this is like a cheat sheet, okay? So here we have the respiratory assessment. It's very important to know your patient's history. For example, it's very important to look at the patient's medical record before you go into the room and assess them. This is very important to understand what is the patient's diagnosis and what is the reason that the patient is there, obviously, right? Because these are the things that you're going to want to look at when you're in the patient's room and try to figure out how exactly is your patient doing. So in the notes here, you have a list of things that can be occurring with your patient. For example, for the history, if your patient has respiratory issues, be mindful if your patient presented in the hospital with cough. Maybe they have blood in their cough. Maybe they have a swelling of the lower extremities. They could have low energy. They could have a sleep pattern. So these are things that are right here and they're listed here. And this is just for you to kind of get like that overview and that background. And it's very important when you are in the room to ask your patient, how is their medication working? When you're gathering all this information from your patient, it's a good idea to also be mindful of what's going on around you. And when I say what's going on around you, I just mean using your 5 senses. So for example, like your eyesight, your hearing, your taste, your touch, and your smell, right? And when I say these things, it's like you want to notice, example, like your eyesight. You want to see exactly, like if your patient's on a ventilator, let's say, for example, you want to see if your patient is on a nasal cannula. You want to make sure and also see with your eyes if the patient's nostrils, are they red? Are they flaring? Are they dry? Is there any mucous membrane coming out? So these are the things that you want to use with your eyes. When I say use your senses for hearing, what I'm saying is you want to listen to your patient, how they breathe, right? Do you hear any wheezing going on? Like, are they making any noises? For example, like, that wheezing sound. You want to just be mindful of that as well. So these are all of the things that you're in the room. Remember what you're listening to, so that way you'll be able to document that and come up with a recommendation, right? Other things that are here listed on the notes, I have respiration. It says rate the depth, the effort, and the pattern. So once again, you could do this while the patient is speaking. Sometimes you'll ask them a question and you just kind of look at like how their chest is moving up and down. And you just want to be mindful of patients that have COPD. And sometimes they can have like this barrel chest. Just be mindful and use your eyes and see, okay, how is the bed? Like, is it at a 90 degrees, a 45 degree? Because these are the things that could also help your patient. These little simple things you just want to be mindful of and always use your eyes, right? So other things I see here, like palpate, for example, you want to palpate your patient and see, like, palpate their skin, see if it's cool, see if there's any swelling going on their legs. Because sometimes that could be from the medication, right? If they're using Lasix, all of this swelling can occur. On the notes here, it says palpate the anterior and posterior thorax for any subcutaneous emphysema, like crepitus and tenderness. Moving forward, the notes here says to percuss, and it is percussing for any anterior and posterior thorax. So let's say, for example, if you hear like any hollow sounds or any dullness, and you could also assess for any flatness, like for the muscle or bone. And last but not least, you auscultate. I'm going to share with you guys like this really cool, like, I don't know if you call it Tic Tac Method, but this is something that we learned in class, and it's really cool and it's simple, and it's definitely going to help you guys. I do not have a person to actually do this on, so I'm just going to share with you guys on paper. In order to remember this, all you have to do is just draw dots. You're going to draw a left dot, a right dot, then you're going to want to draw a dot underneath, and then to the side, underneath, again to the other side, and you're going to just repeat this pattern like 5 times, right? So after you repeated this pattern, you want to start on your left, then you go right, then you go underneath, then you're going to go left again, underneath your left, then you're going to go right, underneath your right, then you're going to go left, underneath your left, and then to your right. This is going to be the same exact way that you're going to want to osculate your patient. You're going to always start at your left, then you're going to go to your right, underneath your right, then to your left, underneath your left, then to your right, underneath your right, back to your left, underneath your left, and then to your right. Really quickly, just be mindful of your respiratory patterns. For example, like your normal breathing sounds are going to be 12 to 20. Anything above 20, always remember it's tacky because it's fast, right? Anything below 12, it's going to be Brady because it's slow. Now, if a person is hyperventilating, always remember that it's rapid, deep respirations that are more than 20 breaths. Other things to quickly consider would be if the patient is apneustic, if the patient is having any Cheyenne strokes, if the patient is having any Kussmaul breathing, and also air trapping. Last but not least, we are onto our lung sounds. It's very important to differentiate the difference between sounds like cracking, wheezing, raunchy, or in a life-threatening situation, which is called a stridor, and know when there are any absent or diminished sounds going on. Quickly, crackles, just remember it's this popping sound, and it's always heard on inspiration in the lower basses, and this is commonly due to congestive heart failure and patients who have anomia, right? Wheezing is a high-pitched sound. It's a squeaking sound, and just remember that mostly your patients that are wheezing, like they have asthma, sometimes COPD, and also it could be caused by emphysema. But the sound that could distinguish this from all the others is that when a patient has wheezing, like you'll hear it, like it's gonna sound like like that's the sound that it sounds like. Raunchy is a coarse, harsh, and a loud gurgling or a rattling sound, and this is often relieved by coughing, and it happens with patients who have bronchitis or also anemia as well. Stridor is something that you have to keep in back of your mind. It's a life-threatening situation, so this is an emergency. Like, call your doctor, call a physician immediately, right? And when you're also assessing for your lung sounds, just be mindful, like, if you hear any absence or diminished sounds, because this could also be because the patient had like their lung removed, or they had tension of the pneumothorax, or they had hemothorax. Last but not least, guys, document. This is something that my lab teacher always taught me, because if something occurs, you are liable for it. So document everything. I hope that this video really helps you guys. Thank you guys so much for watching, and please stay safe and enjoy your day.